Question 7. Humoral immunity is mediated by options A. Natural killer cells, B. T lymphocytes, C. B lymphocytes, D. Suppressor T cells. Answer of this question is option C. B lymphocytes. Question 8. The temporary hardness of water is due to presence of options of this question is A. Calcium chloride, B. Calcium bicarbonate, C. Magnesium sulfate, D. Calcium sulfate. Right answer of this question. Option B. Calcium bicarbonate. Question 9. A clinical sign that indicates the beginning of second stage of labor is options A. Change in uterine shape, B. Bearing down reflex, C. Passage of mucus plug, D. Gush of dark blood. Right answer of this question. Option B. Bearing down reflex. Question 10. An example for superficial reflex. Options A. Babinski reflex, B. Stretch reflex, C. Biceps jerk, D. Triceps jerk. Right answer of this question is option A. Babinski reflex. Question 11. Insulin 10U in 50 ml of 50% dextrose is prescribed for a patient with chronic renal failure to reverse. Options A. Hyponatremia, B. Hyperglycemia, C. Hyperkalemia, D. Hyperkalemia. Right answer of this question is option D. Hyperkalemia. Question 12. A system of ventilation that blows fresh air into the room by centrifugal fans to create a positive pressure and displace the vitiated air is options A. Exhaust ventilation, B. Balanced ventilation, C. Air conditioning ventilation, D. Plenum ventilation. Right answer of this question is option D. Plenum ventilation. Question 13. While preparing a pregnant woman for amniocentesis, the nurse should options A. Prepare her for anesthesia, B. Instruct her to drink 1 L of water, C. Instruct her to void, D. Place her in left lateral position. Right answer of this question is option C. Instruct her to void. Question 14. The staple food of villages of 3000 population is maize. These villages are at risk for options A. Pellagra, B. Bitote spot, C. Scurvy, D. Beriberi. Right answer of this question is option A. Pellagra. Question 15. Which action confirms that the nurse is using Z technique to administer iron injection? Options A. Creates a Z-shaped grid on the abdomen and injects each dose daily. B. Uses the anterior lateral aspect of the thigh to inject. C. Pulls skin downward or laterally before inserting the needle. D. Uses special syringe to administer injection. Right answer of this question is option C. Pull skin downward or laterally before inserting the needle.